Studies show up to 50% of women have urinary incontinence, a problem not many want to share that they're dealing with. But the truth is, you are not alone. Dr. Benjamin Steinberg explains why and what you can do about it. Now today we are talking about incontinence, and it's a topic that not a lot of people really like to talk about.
That's right.
What exactly does that mean?
So urinary incontinence, by definition, is involuntary leakage of urine. So anytime you leak urine when it's not in the bathroom, that by definition is urinary incontinence. There are many different types of leakage, but the two most common types are stress urinary incontinence, which is a leakage with coughing, sneezing, laughing, running, exercising, jumping on the trampoline. And then there's overactive bladder or urgency urinary incontinence, which is having the urge to go to the bathroom and not making it in time.
And you're seeing this a lot with women, obviously.
Correct.
So what are some of the risk factors that women might get this?
So some of the most common risk factors, number one, are age. Also previous childbirth. Some studies show previous hysterectomy can increase the risk of incontinence and prolapse. Obesity can increase your risk factors, and also hereditary genetic components as well.
So the symptoms aren't fun, but the good news is that they don't have to deal with them. There is some steps that we can take.
Correct.
To fix it. What do you do?
Well, the biggest step, first of all, is starting the conversation. The International Continence Society quoted a study that the average woman waits approximately 6 years before they actually go talk to a doctor about it.
It's too long.
It is way too long. 45% of women, in a big study done by the Journal of Urology, showed that 45% of women don't even seek care ever. Because the problem is women are embarrassed, there's a stigma to it, and it's very difficult. It's a difficult conversation to have. So most women are forced to live with it. We're calling it a silent epidemic because no one talks about it. So the biggest first step would be to start the conversation, whether it's a friend, you can go to your primary care doctor, you can talk to your gynecologist about it, or you can come to the specialist, the urogynecologist, and that's the best first step you can take.
And then what happens after that?
So once you take that first step, you talk to a doctor about it, you do the history, you do the physical examination, the evaluation, and after that you are offered your treatment options. Your treatment options, and most people think surgery is the only option. That's not true. There's very conservative options, such as simple things such as weight loss, physical therapy, strength training. There's non-surgical options that sometimes vaginal rejuvenation can help, non-surgical. There's urethral bulking, and there's also the mid-urethral sling. And those are for stress incontinence. Now when you get into urge incontinence, which is the overactive bladder, now you're talking about your medications, your Vesicare, things like that, Myrbetriq. Something simple, avoiding caffeinated beverages, artificial sweeteners, caffeine, sodas. And if that doesn't work, then there's surgical options for the urgency as well, like bladder Botox, InterStim. There's a non-surgical ankle stimulation we use called percutaneous tibial nerve stimulation that has no risk whatsoever. So there are many options, not just surgical, for incontinence.
I'm sure that's encouraging, but of course, step one, just start the conversation.
Start the conversation, exactly.
We can start there. All right, doctor, thank you so much. We appreciate your time.
Thank you.